Okay, we'll wait another minute here before we start our introductions.
Do you introduce us or do we introduce ourselves?
I just introduce, like I do a kind of a top line overview, but I don't personally introduce each of you. So if that makes sense. Okay. I'm assuming when I click broadcast, yep, okay, there we go. All right, welcome everyone, or we'll wait and, oh, it is 6:30 on the dot, so we'll go ahead and get started. My name is Susan Kappas, and I work at the University of Illinois in the College of Agricultural, Consumer, and Environmental Sciences. I'm your facilitator for today, and welcome to the Virtual College Exploration for all Illinois students, sponsored by the Illinois Association for College Admissions Counseling and StriveScan. Thank you for joining us. A few housekeeping announcements before we get started. You can use the Q&A button on your screen to type your questions to our presenters at any time. Your camera and microphone are off, so the panelists cannot see or hear you. This is just one of many different sessions happening, so be sure to check out the full schedule at IACAC.org. This presentation is being recorded and will be available within about a week on the same website, which is IACAC.org. So now I'm going to turn it over to the presenters.
All right, well, welcome guys to the Healthcare Profession Educational Opportunities in St. Louis area. So all of the people talking today are going to be obviously from the St. Louis area. And I think Julie is going to kick it off for us. So I'm going to go ahead and give it over to her.
Hi, I'm Julie. I am the recruitment specialist at Boise College of Health Sciences at SLU. So to start off, welcome to the presentation. We'll go over each of our programs individually, but there are a few things each have in common. All the Boise programs have an opportunity to study abroad, whether for the semester or the summer, and all the programs have a rolling admission with the exception of occupational therapy and physical therapy. First up, we will talk about the SLU Athletic Training and Physical Therapy program. St. Louis University's athletic training program offers an early assurance 3+2 graduate professional program. Students earn a Bachelor's of Science and Exercise Science after completion of 4 years, and then a Master of Athletic Training after successful completion of an additional post-baccalaureate year. Students may also enter the program as transfer students or as a post-bac. And for freshman entry, the minimum GPA requirement is a 3.0. Athletic trainers practice injury prevention, injury assessment, rehabilitation, and sport-specific conditioning. It also includes administrative duties and other professional development opportunities. The diversity of the clinical sites is a hallmark of this program, with partnerships with 8 other St. Louis area universities and over 20 high schools. Clinical experience starts in the senior year. Students will get to rotate between locations such as high schools, colleges, private clinics, hospitals, and outpatient settings. In prior years, some students have had the opportunity to work in the Minnesota Vikings and a rugby team in Australia. Our physical therapy program is an early assurance freshman entry program. Students receive a Bachelor's of Science and Exercise Science after completion of the first 4 years and the DPD degree after successful completion of an additional 2 post-bac years. And that is a total of 6 years. All students are required to complete a minor of their choosing. And the minimum high school GPA requirement is a 3.2 on a 4.0 scale with an emphasis in math and science. Strong applicants will have 4 years of math, including a course equivalent to pre-calc, 4 years of science, including physics and anatomy, and activities demonstrating leadership and community service, and an interest in the profession of physical therapy is demonstrated through observation, school activities, and personal experience. And the application deadline is December 1st. Physical therapists work with people across the lifespan to optimize movement and improve health. The duties of a PT include evaluation of clients, development and implementation of intervention program, patient care education, and delegation of patient care responsibilities to other healthcare practitioners. SLU's program in physical therapy is affiliated with more than 300 clinical sites locally, nationally, and internationally. Students complete 38 weeks of full-time clinical experience in the professional phase. Elective courses and clinical exposure help students gain advanced knowledge and skill in specialty areas such as pediatrics, sports, geriatrics, and movement analysis and neurology. There are 3 labs with a linked audio and video so students can receive information in labs through the large screen TV and camera system. One of the labs is open 24/7 for students to practice in when not in use. We also have an occupational science and occupational therapy program, which is a 5-year freshman entry master program. Students earn a Bachelor of Science in Occupational Science after the completion of 4 years, and then a Master of Occupational Therapy degree after successful completion of an additional post-bac year. Freshman admission criteria includes a minimum GPA of a 3.2 on a 4.0 scale, with 4 years of high school science, including chemistry and biology, and preferably anatomy or physics is also required, along with our 4 years of math and 4 years of English. Application deadline for this program is also December 1st. Occupational therapists work with people of all ages across the entire lifespan to improve the quality of their everyday lives and allow people to live life to its fullest. For an occupational therapist, this means focusing on a person's occupation, including anything a person wants, needs, or has to do. OTs partner with the client to plan interventions that promote health, focusing on activities that are important and meaningful to the individual and the community. Applied experiences are an integral part of the curriculum, with affiliations of 300+ fieldwork sites across the United States. Students participate in several levels of clinical experiences and fieldwork beginning in their junior year and culminating to the completion of 2 12 full-week fieldwork experiences in a variety of settings beginning in year 5. Our OT performance lab is used for hands-on course instruction and includes a therapeutic gymnasium where students practice treatment with equipment such as workout balls and foam climbers. OT Daily Living Lab provides space for students to apply learn knowledge, and the instruction of adaptive living skills for individuals. This lab includes a kitchen and a model bathroom. The great thing about all 3 of these previous programs is that once accepted into the program, a student will progress through the entire program without the need for reapplying or taking the graduate exam. Students have a seamless direct entry into the AT, PT, and OT programs. Now we will move on to the majors included in the Clinical Health Sciences Department. The HIM program, the Health Information Management, is a great program if you're looking for a non-clinical side of healthcare and are interested in the study of medical science, information technology, legal concepts, and health management. Health information professionals are recognized experts in clinical and healthcare operational data. The program provides students with hands-on exposure and experience with typical systems utilized in the healthcare industry, such as encoding systems, database management, and statistical software. The HIM program has affiliations with local clinical sites for students to complete their professional practice in the last year of study. The projects provide an opportunity to experience roles such as electronic health record analyst, consultant, coding, and compliance specialist. Students can also choose to do a minor in HIM. For students interested in advancing their academic path to graduate studies, they may pursue one of the following accelerated programs, tracks: HIM to the Master of Science in Health Data Science, or the HIM to Law, and HIM to the Master of Science in Health Administration. Another program we have is the Health Science program, which provides a holistic view of healthcare that serves as a great pre-professional option for students going on to graduate education. This is a great path for students interested in entering clinically related health fields, as it prepares students for professional and research careers in the rapidly changing world of health. A new generation of health professionals will help provide a fresh perspective and arrive at innovative theories, policies, and technologies that address emerging health concerns. Students who are interested in pharmacy are encouraged to check out the Pharmacy Scholars Program. SLU partners with the University of Health Sciences and Pharmacy in St. Louis, formerly known as the St. Louis College of Pharmacy. This provides access to an accelerated pathway to completing a bachelor's degree and a PharmD. Students spend 3 years at SLU and 4 years at the University of Health Sciences and Pharmacy in St. Louis. This exclusive opportunity offers a guaranteed interview with them. Interested students should complete the Pharmacy Scholars application located in their applicant portal no later than December 1st of their senior year in high school. At this time, only students who pursue a degree in biology or health sciences are eligible for the Pharmacy Scholars Program, and the minimum cumulative GPA is a 3.5. We also have the program Investigative and Medical Sciences Program, which focuses on health, human health, and diagnostic studies. The program has a strong foundation on both basic sciences and medical courses in various areas of diagnostic medicine, such as medical biochemistry, hematology, and hemostasis, fundamental immunology. This is a great program for students looking to advance in healthcare education and is ideal for preparation for medical, physician assistant, dental, pharmaceutical, optometry, or other related health graduate programs. We also have the Medical Laboratory Science program, which prepares students to gain knowledge and skills required in the professional field involving both scientific detective work and managerial competence. Medical laboratory science professionals save lives by performing and assuring the reliability of tests that provide objective information used in the early detection, diagnosis, monitoring, and effective treatment of disease. Up to 80% of clinical decisions are impacted by clinical laboratory testing. This is a great program for students who want to be in the healthcare, but maybe not a lot of patient care interaction, so behind the scenes work. SLU's program has guaranteed placement in clinical practicum training sites. Seniors spend 16 weeks at a variety of hospital laboratories in St. Louis area, such as SMM Health and Quest Diagnostics. Students gain knowledge in areas such as hematology, immunology, microbiology, blood bank, and chemistry. The MLS lab is equipped with modern microscopes, clinical analyzers, and much more for students for hands-on experience. We also have the MRI program, the Magnetic Resonance Imaging Program, educates and trains students to work with patients and others in the healthcare team to obtain high-quality images in a safe and effective manner. The MRI magnet and the radio wave provides excellent contrast between the different soft tissues of the body and is especially useful in imaging the brain, spine joints, muscles, and other structures. The MRI program has affiliations with clinical sites in the St. Louis area where students get over 1,000 hours of clinical practicum in their senior year. In the health science program, we also house the Nuclear Medicine Technology program, which prepares students to be a nuclear medicine technologist. Nuclear medicine is a medical specialty that uses safe, painless, and cost-effective techniques to image the body and treat disease. Nuclear medicine uses very small amounts of radioactive material to diagnose and treat diseases using gamma or PET CT scans. It allows to image that specific organ and the structure. The program has affiliations with clinical sites around the St. Louis area where students gain 1,000 hours of clinical practicum. These hours are completed in the last year and a half of the program. We also have the radiation therapy program, which provides students to be a radiation therapist, which are responsible for administering the prescribed treatment dose of radiation using high energy linear accelerators. Therapists also monitor patients' reactions for radiation side effects and keep highly accurate records of planning, treatment, and equipment use. This profession combines the great satisfaction of helping others during a difficult time in their lives with sophisticated technological equipment and scientific techniques, while also working as part of a multidisciplinary healthcare team. The radiation program has affiliations with multiple sites in St. Louis, where students complete over 1,000 hours of clinical practicum. Students rotate to about 3 to 4 different places, big and small hospitals, all within the driving distance of St. Louis area. Now we will discuss the Communication Science and Disorders program. Studying communication sciences and disorders will prepare students for a career as a speech-language pathologist or audiologist. SLPs help prevent, identify, assess, and provide treatment for their families. SLPs work on areas of language development, acquired language disorders, stuttering, voice, and articulation disorders. Students do need a master's degree to study in this area, which we have at our program within SLU. All students in the program experience guided observation of adult and children in a variety of speech, language, and hearing disorders. There are 2 audiology rooms that students learn to do hearing and screening evaluations. Students also have the option to minor in communication sciences and disorders. The CSD Scholars Program is an opportunity for incoming freshmen who are interested in the opportunity to secure a seat in the SLU Master Program in CSD upon graduation. Interested students should complete the CSD application located in their application portal no later than February 1st. And the minimum cumulative GPA is the 3.5. Lastly, we have the Nutrition and Dietetics Program. It is one of the few in the nation that allows you to become both a registered dietitian, nutritionist, and certified chef. Dietetics in the application is the application of food and nutrition knowledge to promote health, prevent disease, and minimize disability. Dietitians are dedicated to helping the public attain better health and longevity through the use of sound nutrition practices. And then lastly, I will talk about our PA Scholars Program. The PA Scholars Program is an exclusive opportunity for freshmen to be guaranteed a position in SLU's Physician Assistant Program upon graduation from specific pre-PA degree programs offered by the Boise College of Health Sciences. Applicants can go to the portal, and the application deadline is December 1st of their senior year of high school. And the minimum cumulative GPA is also a 3.5. And that is a wrap for mine.
Awesome. Thank you, Julie. All right, let's see here. Okay, hi everybody. My name is Jordan Lair. I am an admissions representative with the University of Health Sciences and Pharmacy in St. Louis, also known as UHSP. We actually were formerly St. Louis College of Pharmacy, so if you are from the St. Louis area, you probably know us as that, and we most definitely are still St. Louis College of Pharmacy, same school, same legacy, same all the good stuff. We just offer other undergraduate degrees, and so we wanted our name to reflect that, hence the university name, and so we just have the College of Arts and Sciences and then St. Louis College of Pharmacy, which I will get into in a second. A little bit about our school. So we are small, but we like it that way. We do it on purpose. We're a little over 1,000 students, total enrollment. That's undergraduate and professional students. We're represented by 28 different states and 22 different countries. So even though we're small, we have students from kind of all over. We're 62% female and 38% male. We do have a 10-to-1 student to faculty ratio. That is on average, and all of our labs are capped off at 25. Our general education classes are taught through a healthcare lens. So the University of Health Sciences and Pharmacy, that's all we do is health sciences and pharmacy. So everything that you're going to be learning from the second that you're starting class as a general education class is all taught through that healthcare lens. And it's a really great aspect and benefit to have as a student because you know that all of your peers are going to school for the same thing that you are, or at least the same realm. So it's not a competitive environment. It is kind of a cliche, but it is kind of like a big family. Students do really lean on each other and on their faculty and staff to kind of just help them get through the programs. So we have 6 different undergraduate majors, 3 pharmacy pathways, 2 graduate opportunities, and then 4 advanced opportunities, which are kind of all plus programs. If you are familiar with the St. Louis area, we are located in the Central West End. And we actually are located in the heart of Washington University's medical campus. So we're surrounded by this medical community because we have WashU's Med School on one side. And then we also have Barnes-Jewish Hospital, which is ranked like the 14th or 15th best hospital in the United States on the other side of us. And this is just a little bit of a map to kind of show you in which we're located. So our buildings are 1, 2, 3, 4, and 5. And then number 6 over here and all the way around is Washington University's medical campus. It's just a really great benefit to have when you are a student that's going to school for something in healthcare, because there's a lot of traffic through our campus. And so students do, make a lot of connections and network with people that are all around this one area. So it kind of is the best of both worlds. You get the small school aspect, but you walk outside and you're in this big school kind of atmosphere. Healthcare in general is a really great place to be wanting to get a job in, because it's supposed to be by like 2028. There's supposed to be 1.9 million new job opportunities just within healthcare alone. So you really cannot go wrong with trying to find a career within healthcare because you're gonna have job security, which is obviously really important. The first set of bullets is just the tip of the iceberg of what some of the degrees that we offer can get you a healthcare career in. And then the second is pretty much just a couple of different practice types of settings that you can do within pharmacy specifically. So that's kind of how they're divided up. So for our undergraduate degrees in our College of Arts and Sciences, we have global health, which is a bachelor's of arts, and that's going to be what's going on in the world right now, right? So epidemics, pandemics, if you want to do public health, any kind of social justice, equity, that side of healthcare, global health is going to be kind of the degree that's going to get you a job there. Medical humanities is kind of like an umbrella. That's how I explain it, because there's so many different things that you can pursue with a medical humanities degree. So you can do healthcare communication, you can do hospital administration, you can do nursing, health psychology. The list just kind of goes on and on. So this is a really good major if you are a student who wants to do the liberal arts side of healthcare, want to do a ton of like really heavy science classes. Medical humanities is going to be the best route to go for that. Biomedical science is your typical quote unquote pre-med degree. It's going to take you, if you want to do med school, vet school, dentistry, OT, PT, the list kind of goes on and on. So that's going to be your basis. Obviously it's biomed, so it's going to be that cool medical knowledge twist to biology. We do also have a nursing program. It's a partnership with Goldfarb School of Nursing, which Goldfarb School of Nursing was actually created by Barnes-Jewish Hospital, the hospital I was talking about earlier, and they are located directly across the street from us. And so what students do is they do their prerequisites with us for 2 years, the first 2 years, and then they go to Goldfarb for the last 2 years. So it's a 4-year program, and you come out with a bachelor's of science in nursing. And if you have a 3.0 GPA coming out of high school, then that is a directed entry for Goldfarb. We also have a pharmaceutical chemistry degree. Now it says pharmaceutical, but it is a chemistry degree. And this degree is actually super flexible. It has a ton of options for electives. So it's a really cool degree if you're super into chemistry, but also kind of want to make your own degree a little bit, because you do have a lot of flexibility to choose the electives that you want. And then pharmaceutical science is pretty much what we pair for our integrated pharmacy degree. But this also is a really good option for students if you are wanting to do medical school. Med schools do like the fact that students have degrees kind of outside the typical pre-med or biomed degrees. And this also is a really good foundation if you are interested in psychiatry as well. For St. Louis College of Pharmacy, there are 3 different pathways, but the 4-year program is typically for students who have already completed 2 full years of pre-pharmacy coursework or a bachelor's degree at a prior institution. So for students that are coming just directly out of high school, you're going to want to look at the 6-year and the 7-year. The 6-year is pretty much just 2 years worth of pre-pharmacy coursework that you are laying the foundation for the classes that you're going to be taking while you're in the professional program. So no matter what, a PharmD is going to take 4 years to do regardless. And so it's really just, it depends on what you do before. So the 6-year is just that 2 years worth of pre-pharm courses. And then the 7-year is actually an integrated bachelor's degree. So we take that pharmaceutical science degree, condense it into 3 years, and you get your bachelor's degree as well as your PharmD degree. I always get asked, obviously, the benefit one versus the other. 6-year is going to be, you're saving time. But the 7-year, since you have that bachelor's degree, it is going to make you more well-rounded because you're taking other classes than just those pre-pharm classes. And if you are interested in the pharmacy pathway, I definitely want to talk about residency programs. So let me know in the chat box in the Q&A, and I'd be happy to talk more about those. We also, so for our advanced opportunities, we also have a master's in global health and equity. And this kind of coincides with that global health degree. And then we also have a master's in medicinal chemistry, which then coincides with the pharmaceutical chem route. So if you're wanting to kind of further your education there, you can kind of just slide on in. We also do have a dental medicine program. It's partnered with A.T. Still University, which is a school in Missouri. It's a school of dentistry and oral health, and they actually do reserve 3 interview applicants per year for our students. We also have an integrated PharmD and MBA. So if you are in the PharmD program and you're wanting to get a master's of business administration, you can do so at University of Missouri St. Louis, which we call UMSL. Or you can just get a certificate of business administration, totally up to you. This is something if you're wanting to kind of own your own pharmacy or get into consulting, something along that line. And then we do have an occupational therapy and a physical therapy program. They're both partnered with WashU's School of Medicine, which both of those programs are actually ranked #1 in the United States for OT and PT. The occupational therapy is a 3+2 program for a master's and a 3+3 for a doctorate. And then the physical therapy is a 4+3. So 4 years with us, 3 years with them, but they do reserve 3 spaces each year for our students. Of course, there are requirements in GPAs and scores that you need to meet, but our advisors prep you from that, the time that you are a student with us. And then, of course, if you're a senior, our application is open. We do not have any application fees. We do review holistically. So we are test optional. If you don't submit a test, we just ask for some recommendation letters. Early decision and early action priority dates are December 1st, and regular decision is March. That's for any and all of our programs. And then, of course, the earlier you apply, we do send out some cool little bags full of free goodies, which is always great. And then we do have a ton of ways to experience campus, which is always my biggest piece of advice for students. So reach out to us or to me, to anybody in my office, and we'll definitely help you set something up. So here's my contact information. It's really brief. Take a quick picture. I'm going to move on to Antonio, but I think our contact's also at the end. So
thank you, Jordan. So pathways to healthcare profession. My name is Antonio. I'm Assistant Director of Admissions at Maryville University. And I'll talk a little bit more about Maryville in the next slide, which our total enrollment is a little bit over 11,000 students, but our traditional undergraduate population on campus is roughly about 2,900 students, close to 3,000 at this point. We do have all 50 states represented in our on-campus population, as well as 58 different countries. over 90-degree program options. If you're not interested in the healthcare and you're still listening to this presentation, we do have over 90 different program options that students can choose from. We're NCAA Division II. Our average class size is about 25. Our student to faculty ratio is actually 14:1. Then we do have over 100 clubs and organizations, and we are 22 miles west of the Arch, so of the Mississippi, in St. Louis, Missouri. Moving forward, I know Jordan touched base a little bit on this, but by 2029, there'll actually be an additional 2.4 million jobs in the healthcare profession field. So if you're interested in the healthcare profession field, probably now's the time to hop in the healthcare quote unquote bandwagon, but it will allow you to have secure job opportunities for the next few years. With that said, we're moving on to the next slide. Why should you choose healthcare profession? Of course, number one, why we go to college is to secure a job. So healthcare is a great path to a job security. Location options. In the healthcare industry, you'll be able to work anywhere, basically in the world, of course, and anywhere in the U.S. Majority of the cities, bigger cities, smaller cities will also have hospitals. And then it varies the education levels that you are required to work in the healthcare profession, of course. You don't need a doctorate, you don't need a master's degree to be a healthcare profession. And it also allows you to advance in your career fairly quickly. Competitive salaries, we know that that's important for us whenever we go to college to get a better job that betters ourselves and moves forward. And then it's rewarding. You're there assisting and helping others throughout the process, whether it be throughout some bad times or whether it be throughout some good times. You're there assisting others. So in the next one, we'll look at things students should consider when interested in the healthcare industry. Sorry. So if you have great communication skills, you're passionate about assisting or helping others, you believe that you're flexible, so you are able to work either on the fly, or you'll be able to be flexible by assisting multiple people at the same time, is something you should look into. If you're a team player, attention to details, empathy, as well as you're technically savvy. So if you're good with technology, it's another way to actually consider joining the healthcare profession, as well as assisting others. On the next slide, we'll talk about the healthcare professions and pathways that Maryville University offers. So we do have a few direct admin and guarantee programs. So we'll start with our nursing program. So 4-year bachelor's, of course. Minimum criteria to be eligible to be accepted into the program is a 3.25 QM GPA and a 4.0 scale, and have a 3.0 in math and science GPA and a 4.0 scale as well. If you do not meet the GPA criteria, we can also look at your ACT. If you have a 23 on your ACT, or with 20 math and science sub-scores, you should also be eligible for the program. We also have a direct entry physical therapy program, which is a 6.5-year doctoral program. Minimum criteria in order to be eligible to be reviewed for the program is having a 3.25 QM GPA again, with 3.0 in math and sciences, or 24 ACT with sub-scores of 20 in math and sciences. 2 letters of recommendation. We typically offer or require observation hours, but this year we're actually waiving them due to COVID. So 3.25 QM GPA with 3.0 math and sciences, 2 letters of recommendations, and applying to the institution prior to November 1st in order to be considered or review on the first wave. We're rolling admissions, so we should be able to review applicants all the way up to the end of summer. So keep that in mind. But my recommendation, of course, is applying in the first wave of applicants to get reviewed in order to have a better chance of getting admitted into the program. We also have an occupational therapy program, which is a 6-year master's program. For minimum criteria to be considered for the program, it's actually a 3.25 QM GPA. If you meet the requirements, we'll compile your application and send it to the occupational therapy school, and then they'll make the decision on the students who get admitted. We also have a 6-year speech language pathology path as well, and the bare minimum criteria is, again, is a 3.25 QM GPA in order to be considered for the program. We also have a wide range of pre-health profession programs as well, opportunities for students. So we do offer pre-physical therapy, pre-occupational therapy, communication science and disorder, as well as a wide range of pre-athletic training, pre-chiropractic medicine, pre-dentistry, pre-med, pre-optometry, pre-osteopathic medicine, pre-pharmacy, as well as pre-physician assistant and pre-vet as well. So there's a wide range of pre-health profession opportunities for you guys as well as our direct entry or early guarantee programs. We move to the next slide. We'll talk a little bit more about our nursing program. So for the past 7 years, we have barely stayed above 91% for the first one. Shows our graduation rate, basically our NCLIP for those of you who are interested in nursing. It's pretty solid numbers. So we'll move on to the next one, which we talked about, our physical therapy program licensure passing rate, which we have 100% passing rate in the first attempt, which our students, this is for students who graduate from our doctoral program in 6 years. For the past few years, we have had a 100% not only passing rate, but also job placement. We have, for our clinical students are able to do it all over the US. So if you're from out of state and you're interested in doing your clinical practicum close to home, you should be eligible to do that as well. And then moving on to the next one, our application is fairly simple. It should take you no more than 15 minutes to complete in our online program or our online application, and it's free as well. We also take Common App as well as Coalition. So if you guys are deciding to choose to apply through either one of those, you guys should be able to do that as well. We review holistically. We're test optional. We've been test optional for the past 7 years, so I don't foresee that changing in the near future. So we'll take a look at, of course, your high school transcripts as well as your letters of recommendation if you choose to submit them. And if you submit your additional achievements as well, that'll be great talking points if you're competing for our competition scholarship opportunities as well. And then if we move on to the next one, I'll give you a breakdown of what Maryville tuition looks like. This year, we actually did a 5% tuition reduction, which has brought our tuition down to $24,766. And our total cost of attendance is roughly about $37,466. And 93% of our students actually receive some form of financial aid from our institution. If you guys have any questions, I'll take a snapshot and look at the Maryville University /scholarship opportunities, and you should be able to see all the scholarships there as well. Next is my contact information, as well as a wide range of Maryville visit opportunities. We're doing a Saint sneak peek every Wednesday for the month of October. We're featuring different faculty in our website, where they have the opportunity to talk about their specific programs on campus. And then Maryville Live, which we have a student who actually interviews other students throughout the semester and gives you a little bit more about the perspective of what being a student at Maryville looks like, even though, you know, we're living in some unprecedented times, but we managed to switch that a little bit and give it to you guys digitally as well. And then the next slide, if you guys have any questions for us, I see that some people have started asking questions in the chat. All right. So Parker asked, for pre-med students, how do you help facilitate shadow opportunities? Do you help students make contact with when you leave the students? Yes. So we do facilitate shadowing opportunities. We have a pre-med specific faculty on our campus specifically that allowed our students, that will meet with our students regularly if they're interested in applying for med schools, if you're interested in joining our LECOM agreement program as well, which has about 4 direct entry programs into the LECOM, which is like your course of osteopathic medicine, and you will meet with one of our faculty. Parker asked again, what percentage of Maryville students enroll in medical school upon graduation? Like I said, Parker, it depends on what type of our students choose. If they choose to do the joint LECOM program, they got 4 spots guaranteed, but I believe it's a little bit over 90% of our students continue to follow up into their medical school programs. And yes, we do have all the LECOM connection as well. Parker again, and I do not have the MCAT stats with me, but if you took a contact, I'll put my contact information. You should be able to email me and I should be able to get that for you as well. Do you guys have any questions for any one of us again? If so, I'll turn it over to StrideScan and they'll be able to take over.
Awesome. Well, thank you everyone for joining us today. When you close this window, there will be a link to a very quick 4-question survey. We'd appreciate any feedback you can provide. Also, if this is just one of many sessions being hosted, so be sure to sign up for additional sessions at IACAC.org. In about a week, you'll be able to find this as well as all of the other session recordings at IACAC.org. So thank you guys.
Thank you.